Good morning to you, friends. I'm Dr. Colonel G.S. Chowdhary, retired from the Indian Armed Forces and now practicing in Indus Super Speciality Hospital. Today, I'll be talking about a very common disease, which is lung cancer prevention. And we all know that an ounce of prevention is worth a pound of cure. And lung cancer is a very dynamic disease and is the number one killer disease in the world, especially in males. And this global problem remains because most of the patients we encounter in our daily practice are suffering from lung cancer because of smoking. The risk of this cannot be more than emphasized. Tobacco taken in the form of cigarette smoke or non-smokeless tobacco is a scourge for humans, and we must do all that we can prevent it. We have already had legislation, we have had gory pictures on the cigarette packets, we have also had small, very irritating introductions for the public during their watching a cinema or a movie at the theatre, where most people tend to refrain to start looking at their phones or walking out. But this is the hard truth that smoking causes aerodigestive cancers and also lung cancers. So we identify the population who is at risk for developing lung cancer, which is in the age group of 55 to 75 years. They also are heavy smokers having more than 30 pack years of smoking history or maybe taking tobacco in various forms. It is this target population whom we emphasize should come and visit the doctor. In the 1940s, 50s and 60s, we used to simply do a chest x-ray or a sputum cytology examination or both to identify lung cancer patients. But it was only in 1952 that the US Surgeon General and 1954 that the MRC in the UK pronounced that cigarette smoking causes cancer. Having known this, we realize that various screening modalities have not reduced the mortality of lung cancer. So to reduce the mortality of lung cancer, now there was a North American lung cancer trial study, which was known as the NLTS study, which looked at more than 53,000 of people and compared a simple chest x-ray with a helical single breath hold CT scan, which gave a low dose emission of radiation, and in 15 seconds compared to many minutes for a conventional CT scan, a simple exposure of 1.1 millisieverts compared to 8 millisieverts in a conventional CT scan, we could detect nodules in the lung in asymptomatic people. So we must screen these high-risk heavy smokers for lung cancer by doing a low-dose CT scan and then evaluating them further. This simple technique has been the only method to reduce the lung cancer mortality by almost 20%, and this is a very significant step. So if you are a smoker, I urge you today to give up smoking, to tell at least 10 other people of your friends and family and contacts to forget smoking, to give up tobacco, because this does no good. It can only harm us. Secondly, we must get ourselves screened with a low-dose CT scan, which has a very minimalistic exposure to radiation, but helps us in detecting lung cancer. Let us all fight and strive together to make this world a cancer-free globe. Thank you for your patience.